Good evening friends, myself Dr. Vinay, and today we are going to discuss jugular venous pulse. This topic is both of practical and clinical importance and also a very important topic for NEET PG and INI CET exams, right? So just look at the basics of jugular venous pulse first of all, right? In jugular venous pulse, our first wave is our A wave. The A wave is because of atrial contraction, the atrial systole, right? The next wave is X descent. This X descent is because of atrial diastole, right? In next we have got the C wave, right? The C wave is very important exam wise. It has been asked something like 2 to 3 times in NEET PG and INI CET exams, right? The C wave is because of the bulging of the atrioventricular valve into the atria, right? And after that we have got the X dash descent, right? Now this X descent and X dash descent, both of them are because of atrial diastole. That means the atria has started relaxing from this point, right? And this C wave is just a minor interruption in this X descent. So both X descent and X dash descent, both of them are due to the same reason, and this C wave is just a minor interruption in it, right? It is caused by ventricular contraction and the bulging of the closed atrioventricular valve into the atria. Now coming to our next wave, the next wave is our V wave. V wave is because of the filling of atria. The atrial filling leads to the increase in pressure, which leads to V wave, right? And after that we have got our Y descent, right? What Y descent is due to? The Y descent is because of the passive emptying of atria, right? So as all of you know that most of the emptying of atria is actually because of the passive emptying of atria, right? The atria, the blood is flowing on its own from the atria to the ventricle because of the pressure difference, right? Only for last 20%, only for pushing out the last 20% of the blood from the atria, you need the atrial contraction, right? So this is how the cycle goes on. First of all, the atria contracts, you get A wave, then the atria relaxes, you get X descent. A minor interruption in the form of bulging of the atrioventricular valve into the atria, which is your C wave, right? And X dash descent are both due to the same reason. Then again the filling of atria will lead to V wave, and then passive emptying of atria will lead to the Y descent, and then this cycle will continue, right? This is how a normal JVP will look like, right? But suppose if there are some abnormalities, right? Just in case if there are some abnormalities, right? What could be the abnormalities in this case? The abnormalities in this case could be something like this, right? You can get a tall A wave, right? In which condition you can get tall A wave? In any condition in which atria has to put lot more pressure to pump the blood into ventricles, right? Can we think of the conditions in which the atria has to put in lot more pressure to push the blood into ventricles? Yeah, something like this can happen in pulmonary hypertension, right? Suppose someone is smoking, which ultimately leads to pulmonary fibrosis, ultimately leading to pulmonary hypertension. Now, which ventricle is pushing blood into the lungs? The right ventricle. The right ventricle is pushing blood into the lungs, and here we are talking about right atrium, right? So if the right ventricle is trying to push blood into lungs, which is having hypertension, the pulmonary hypertension, even the pressure inside the right ventricle is going to increase. And if atria tries to push blood into such a ventricle which is already at high pressure, even the atrial pressure is going to increase. So it's like a long traffic jam from your lungs to your right ventricle to your right atria. That's why we get tall A wave over here, right? But what are the other conditions in which we can get tall A wave? Suppose the atria is trying to contract and trying to push blood through the which valve? Mitral valve, right? So if this mitral valve constricts, right, if this mitral valve gets stenosed due to something, right, then also the atria is going to find tough to push blood through such a stenosed valve, right? What we're going to call it? This is our tricuspid stenosis, right? So in condition of tricuspid stenosis also, you will get tall A wave, right? What else, right? Now in this A wave, right, sometimes what we get is that we get very tall A wave, right? We get very tall A waves, right? These tall A waves are actually called cannon A waves, right? So when exactly we are going to get cannon A waves? For understanding cannon A waves, we need to understand that for producing cannon A waves, what we need, that when atria is contracting and trying to push blood into the ventricles, at the same time the ventricles contract, right, and push the blood back into the auricles. So what does it means is that the both atria and ventricle need to contract at the same time to produce something like cannon A waves. And when atria and ventricle can contract at the same time, normally there is something called AV nodal delay. This slight delay is very important, right? First the atria contracts, then there is AV nodal delay, and after it the ventricle contracts. The slight delay leads to coordination between the contraction of the atria and ventricles, right? Suppose we get complete AV nodal block, right? Suppose we get complete AV nodal block, then what will happen, that the both atria and ventricles will start contracting on their own. I mean, in case of complete heart block, first of all what will happen, that the atria will keep contracting, but the ventricle will fall silent for some time, right? And after that what you will get something like idioventricular rhythm, right? Whole of conductive system of heart has got its own intrinsic rhythm to beat. The SA note predominates because it has got the highest rate of autorhythmogenicity, right? Now if this ventricle, right, it starts beating at its own pace and the atria have started beating at its own pace, the both are beating independently, right, independently of each other. So they might beat wide apart from each other on 2 or 3 beats, but on every third and fourth beats, right, they might beat together, right? And just at the point when they beat together, right, you will get something called cannon A waves, right? Now coming to the next point, in which condition you will get tall C waves, right? For tall C waves, you need to visualize that how and why you get something like a C wave. C wave is because of bulging of the atrioventricular valve inside the atria, right? So suppose you get damage in the chordae tendidae fibers, right? Now think of it, what is actually preventing this atrioventricular valve to bulge completely into the atria, right? The chordae tendidae fibers are actually preventing this valve to not to go completely inside the atria. Suppose these fibers get damaged, yeah, the valve is going to bulge excessively inside the atria, and this will give us our tall C wave, right? What else can go wrong with JVP, right? What you can get in JVP is this thing, tall V wave, right? Now what V wave was due to? V wave was due to our filling of the atria, right? Now suppose just in case if atria is getting some extra blood from somewhere, right? If atria is getting some extra blood from somewhere, right, then in that case you can get tall V wave. So from where else the atria can get blood? Atria is getting blood from your superior vena cava and from your inferior vena cava, right? From where else the atria can get blood? Atria can get blood from the tricuspid wall. Just in case if tricuspid regurgitation, right? So just when the ventricle contracts, this tricuspid wall, instead of stopping the blood, allows some blood to come back into the atria. So in that case, in case of tricuspid regurgitation, you can get the tall V wave, right? And after that, you are going to have your Y descent, right? So this in basic about what a normal JVP will look like and what are some basic abnormalities that can happen in JVP, right? In case you have got any doubt or any other query regarding to JVP, you can always ask from me or put your doubts in the comment section, right? Wish you all the best in your studies. Keep studying, keep working hard, right? All the best.